I love plenty of cats. Big ones and small ones, short ones and tall ones, they all make me laugh. Cats, 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 they're all I adore. Though I've got a million, I'd make it a trillion, there's always room for more. Cats, 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 how I love a crowd. Skinny and fat ones, orange and black ones, love the sound of meow. Cats, 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 just knock on my door. I'd never turn one away, not tomorrow, today. There's always room for more. I'll build an addition, expand my living room. It's no imposition. If I could, I would give them the moon. There's nothing I wouldn't do for my cats. Cats, 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 I love plenty of cats. Big ones and small.
Hello, I'm Dr. Joe Gordon with Dr. Wages. Welcome to the Healthy Pet Show tonight. And we have a special guest. We have Dr. Jonathan Friend from the Animal Rehabilitation and Wellness Institute right here in Raleigh. Jonathan, welcome to the show.
Thank you very much, Dr. Gordon.
I appreciate you coming and being with us. And John is from the Animal Rehabilitation and Wellness Institute. And John, tell us a little bit about what goes on at the Animal Rehabilitation and Wellness Institute.
Well, the Animal Rehabilitation and Wellness Institute, we call it RWE for short. It's a pretty big mouthful to say there. We are a referral facility that specializes in the rehabilitation of post-operative and injured pets. Okay. And basically what we do is we dedicated solely to using state-of-the-art equipment to get them kind of back up on their feet again as quick as possible. Right. Minimize their pain and return to function as quick as possible.
So you mentioned post-surgery, but also you work with animals that are just older and debilitated too, right? Is that correct?
We work with geriatric pets, we work with athletes, we work with overweight pets, trying to get them on a weight loss program, and post-surgical cases, and also just injured animals that may not be candidates for surgery.
Okay, and working with the athletes, you're actually just trying to improve their conditioning, is that correct?
Strength,
to make them stronger,
strength and
faster?
endurance conditioning, exactly.
Okay. Very
exactly.
Good. Okay. Now this is a rather specialized area in veterinary medicine, the rehabilitation and physical therapy stuff. How did you get interested in that, John?
Well, I've been a surgeon primarily for the last 10 years or so. I've always used some form of rehabilitative therapy in my post-operative care with all my patients, and recently just become more interested in doing rehabilitation exclusively. And I had a friend of mine that was going through the certification course, so I started looking into it, and then I found RWE, and you know, it's kind of a perfect fit, you know, and just kind of took it off from there.
Right. And there's really only there are only two facilities in this area. There's RWE and then VetHab, which is another physical therapy facility at this time.
What's RWE again?
Animal Rehabilitation and Wellness Institute, okay? Figured if he was saying RWE, I could say
that's right.
Mouthful, but I just want to make sure.
So, but anyway, we've got Dr. Wages is going to run the computer for us, and has got some. You brought some pictures of some of the equipment that you use, right?
Right. We got some pictures of the underwater treadmill, which is one of our primary means of therapy, and then we've got some video clips as well as some case studies as well.
Okay.
So let's see. Let's go through the pictures first. This is a dog that we're using the balance board. Basically, what that does is some of these dogs come in and they're shifting their weight from the bad leg to the good leg, and we're trying to retrain them to center their balance so they use both legs equally.
So that's something people use that too for training. Actually,
for core
it's
training,
a very good strength exercise building for, as you said, core muscles, right?
For the core muscle groups. This is a patient that's receiving electrical stimulation. Basically, we're stimulating the muscles to contract. A lot of these animals will stop using the limbs as a natural mechanism, you know, post-operatively, and this is to stimulate the blood flow to the area and to facilitate muscle contraction and firing.
And sometimes it's good to do this before surgery too,
Absolutely.
on an injured leg to help build up the muscle.
Absolutely. Preoperative therapy is also
Now, is this the same as a TENS unit that a chiropractor would use to stimulate the muscles and get them warmed up prior to doing the manipulation?
There's two kinds. There's actually, but in essence, it is a TENS unit. But there's one that TENS, which is a more superficial stimulation. There's a deeper stimulation. It's called neuromuscular, NMES unit.
Okay.
But this is a TENS unit I believe we're using here.
Okay.
This is just an ice pack. We use a lot of ice, hot and cold therapies in these dogs, and this is just a patient receiving an ice pack, probably on a cruciate ligament surgery. This is a patient that we're training to use the stairs. And believe it or not, dogs use stairs every day in their everyday life, but this is also a good conditioning exercise for strengthening.
So, backing up just to the previous, you don't have to go back to the previous picture. We had an ice pack there. And as far as routine therapy, post-surgery or post-injury, what is your standard recommendation for the use of an ice pack?
We use an ice pack immediately post-op,
Okay.
before they're even recovered from anesthesia.
Okay.
And we recommend doing it for the first 48 hours, and even at home for 2 weeks after.
Okay.
And then you can start alternating some heat after the first couple of weeks.
Okay. How long should an ice pack be placed on the injury area?
We try to do it between like 5 and 10 minutes.
Okay. And then how many times a day?
We'll do as many times as 3 or 4 times a day. Standard is twice a day, but sometimes more.
Okay. Very good. Just some good basic information there.
Certainly.
Right.
It's helpful.
Okay. This next patient, we're actually using one of the therapy balls, again, for flexibility. So the patient that had back surgery, we're just trying to keep everything loose and stretched. And this is use of an ultrasound on a knee of a patient. This ultrasound is not the type of ultrasound you would think of for imaging. It actually sends ultrasound waves deeper into the tissues and actually stimulate repair of the tissue, say a torn tendon or a strained tendon or ligament.
And the concept there is that we're stimulating blood flow to those tissues.
Correct.
So they heal more quickly?
By using heat. It actually heats the tissues.
Okay.
Then back to the original picture. Okay.
Obviously, quite the variety of equipment that you've got there, and
Right.
and
this is only part of it. We haven't even seen most of the stuff we have there. But yeah, those are the basics.
okay.
Okay.
And
Here we have a video clip here. This is a patient using something called the Cavaletti rails. Again, teaching the animal not to shift its weight to the good leg. By overgoing obstacles, it forces them to put both feet down and can retrain them.
and that's simply just a little bar that's raised up?
Just a little bar, and we have, they start them out on the floor like that pup was, and eventually we can actually get them a little higher and higher.
Okay.
Okay, this is a patient just using a treadmill, A lot of us use those on a daily basis, and we never think about dogs using them, but again, good strength and conditioning. A lot of dogs can be disoriented after surgery as far as not knowing where their back end is in relation to their front end. This kind of helps keep them going.
And
Can
is
we
this,
enlarge the script?
that one you can't?
No, this one's pretty small.
Is this something that somebody can do at home? Like, how easy is it to get a dog out
This
of
is
treadmill?
great. Well, some dogs are more receptive to it than others, but with training, you can pretty much train any dog to get on a treadmill.
And you say training, and obviously that's key to get the dog to walk in a straight line and to not want to jump off and go pay attention to something else.
We have ways where we'll stand with them, and you'll see in some of these other photos where we actually have a therapist in the water tank with some of these pets. This is a patient that's actually doing some swimming therapy. Some dogs aren't comfortable by themselves in these situations, but if we have a therapist that kind of calms them and reassures them, and the owner can do that at home as well, to make them more comfortable, because it's all about patient comfort. And we don't want to stress them out in any way, because stress also, inhibits the healing process.
A lot of times people ask about letting their dog swim for treatment following an orthopedic procedure. Again, probably the most common orthopedic procedure we do is a cruciate ligament surgery, and people ask about taking them swimming for that purpose.
Certainly.
Is swimming a good exercise for cruciates, or?
Swimming is a good exercise. What we're looking for is to maintain, flexibility in the hip muscles and the leg muscles in general. It has been thought recently that the swimming is more of an older idea, but recently it's been shown that the underwater treadmill is better because dogs, when they swim, they don't use their rear legs as much as we would like them to. Whereas with the underwater treadmill, yeah, they're more doggy paddle with the front legs. But with the underwater treadmill, they actually are forced to bear some weight on those back legs.
Okay. And we're talking about an underwater treadmill. Is a very special treadmill.
This is it's a special tank, and this is an example of that right now where we have a patient walking on the treadmill. What this is low impact exercise. You can walk the patient, but the water and its buoyancy effect will actually reduce some of the weight on the pet. The pet also has to work against drag, as if anyone's been in the swimming pool, you realize it's harder to move your limbs around in the water. So we're actually strengthening the muscles as well as you know, getting the exercise.
And we see the water's
easier on the joints.
The water's actually quite deep on this patient.
It is, and you can do varying levels of depth depending on what area you want to work.
Okay.
So like when you start them out, you want to usually start with the water higher, and as they get stronger, you drop it?
Actually, I would do the opposite because the more water in there, the more resistance you have to work against.
And then do you have jets too?
We do have jets, so it just increases the resistance they have to work against.
And what do you mean by jets?
Kind of like a jacuzzi jet.
Okay.
Where it actually, you know, pushes the water.
Pushes water against the patient, the direction that they're going in.
Yep.
Okay.
Absolutely. Yep. All right, and I think we've got some case studies on here. This is a video of a few cases that we've had in the hospital. Some of them are pretty dramatic. The first case is Denton, who had neck surgery, who post-operatively couldn't walk. Okay. And he's doing a crab crawl on the floor of the facility. And the ventral slot procedure is just the name of the surgery he had on his neck.
And with a back surgery or disc surgery, he was paralyzed prior to surgery, probably?
He was paralyzed prior to surgery or doing some varying degree of this abnormal gait that he's doing now. And you know, this is pretty standard of some of our patients where they're just not mobile after surgery. We use, you know, at some point we fit them for a wheelchair, just like with people. And you know, 4 weeks post-operatively, he's actually doing pretty well. He's maneuvering pretty well on his own in the chair. These guys just need support, you know, support and time to build up their strength. And this is 8 weeks after he's out of the chair, and he is almost back to normal. He's a little abnormal in his rear end, but for all intents and purposes, he's pretty good.
Moving very well on his own at that stage. And then
at 10 weeks after, he's actually rolling over on his own, which is actually a pretty difficult thing to do when these pets sit, you know, post-operatively. They just don't have their orientation about them. But this guy, he's doing pretty well. There he goes.
So what type of things went on between the time that Benton first came in and was doing the crab walk across the floor, not able to lift himself up, to the time where you were able to get him into the wheelchair?
Okay. Well, pretty much everything that we did, saw the pictures of with the electrical stimulation, the underwater treadmill. We also do massage therapy. We have an acupuncturist that comes in and she'll do acupuncture on some of these guys. And this is an intensive effort. They get it 2 and 3 times a day, you know, every day during the week. And you know, they stay with us during this time for at least a full, you know, 2 or 3 weeks post-operatively to get this done.
Okay, so so this is not a go home in the evening and come back the next morning type of process. It's a matter of just staying there and being there throughout the day.
Right. We keep them there for at least 2 to 3 weeks, ideally. Some longer, and then we can get them coming back on an outpatient basis for the underwater treadmill and some other therapies as well.
Okay. Once they go home, are there typically other exercises that you recommend that they continue to do at home?
Oh, yes, it doesn't stop. I mean, we have owners that are doing range of motion exercises at home. They can even do massage therapy, and they can continue the icing. There's lots the owners can do at home.
Okay.
And once they're on the outpatient, how often do they come in, like during the week?
Twice a week is pretty standard. Sometimes we get them down to once a week. What you want to do is, you know, initially you have very frequent visits, and then you taper them off as they heal.
Okay.
So the goal is to get them completely out.
Ready for Charlie?
Charlie had a total hip replacement.
He started out with 3 legs though.
Yeah, that's a problem. so he has no legs in the back. So it's really hard for him to walk around. This is post-operatively. We're having to assist him in his back end. And 5 weeks after, he's doing the cavalettis, moving around pretty well. And this is the stairs. This is a pretty good strength.
I think that's a really neat application for training that you have there, is to have the stairs, because they do have to go up and down the stairs in the house.
Certainly.
Right.
Now, I think it's important to recognize that, I mean, the boldness of Charlie's case, the fact that he was an amputee already
Right.
with missing one of his back legs, and then his right hip had so much arthritis in it that he had to have a total hip replacement, and which is a very major surgery, even for a four-legged dog to recover from. Takes a lot of effort, a lot of strength, and a lot of dedication on the part of the patient and also then the people that are working with him.
Sure.
So it's an amazing case to see him go from
it is. These guys are so amazing to work with.
Yeah.
It just, it just is great to see them when they recover like that.
Now, did he also use the same tools like the underwater treadmill for building up his strength and such too?
Yeah, there's just so much that goes on. There's always something happening there, and he probably got every tool in the house used on him. So.
Okay. And notice the sling support there. That was something that was new that we had not seen before.
Everybody gets supported initially, because the worst thing about it, post-operatively is if they slip, or bear weight too much too soon, they can actually re-injure, and the whole surgery is wasted. So basically, what we do is there's no leashes and collars in the place. Basically, everybody has a harness and a support, and we just make sure that support is key, for sure.
Very good. Let's go on and look at another case here.
Riker is a dachshund who had a back surgery and got fitted for a wheelchair, and he seemed to have taken to it pretty well. Yeah, need to put some racing stripes on it, but he's doing very well.
Now, was Riker, we saw the dog earlier in the wheelchair that was able to eventually get out. Is Riker able to get out of the wheelchair eventually?
There are some animals that can never regain 100% function of their rear limbs, but they are manageable in a chair, whether it's a front leg or a back leg. There's all sorts of different carts out there for dogs. And some dogs are able to move well, just not great without some assistance like that. It eliminates us having to constantly sling them, because they basically can maneuver themselves.
So the type of chair that Riker was in compared to Benton, the first dog we saw, the first dog was more, the Benton was in more of a rehabilitation chair where you're just supporting your body while you build up your strength. Riker's wheelchair is more of a permanent type of wheelchair, is that correct?
Well, the other difference also is that Benton had what's called a quad cart. Okay, so he basically was functional because he had problems in his front legs and his back legs. Okay, whereas the last patient had just a back leg problem. So you can have a four-wheeler or a two-wheeler, whichever you prefer. So
And,
let's see, and then Sherman, who has actually lost a limb and got fitted for a prosthetic limb. And the one thing to realize with these guys is they still want to play, and so when you see a dog that's actually able to return to function like this, he's happy. He can do his normal things.
So the prosthetic limb there, is this what you typically see that people have, where you strap it on and take it off, or is it a? Yeah,
it's similar. I mean, it's certainly where you take it on and take it off, but I think there's certain cases where there's actually implants that you have to put in as well. Just depends on each individual case.
Okay. I know that's a technology that was developed right here at NC State in Raleigh.
Right
Dr.
here at NC
Marcellin,
State, actually.
Was on the show once and showed the kitten implant that he had developed first time it was shown.
Right.
Exactly. And the last one is Bella, who's a bull mastiff who was actually supposed to have a knee surgery, and she's a poor candidate because of bad heart. So we had to fit her with an orthotic, which is just an assistant type device to help her move around. So this is just a device that's supporting her knees to allow her to bear weight. And she maintained this for a while. She's actually out of the orthotic now, but again, this is part of therapy, is to get them back to a more normal state. So, but she basically retrained her legs and everything, healed, and she's doing her normal thing now.
Great.
And how long did Bella have to wear that orthotic support to rebuild the strength and support of her knee without surgery?
I think it was several weeks.
Okay.
Several weeks. This is not some dogs have to wear them for months, but this isn't a quick fix. This is something that's going to require a lot of intensive effort on parts of the veterinarians as well as the owner.
Okay. Actually, I had a case in today. It was a possible knee injury, might need surgery, but a younger dog, certainly a patient that could undergo surgery. But would this type of orthotic device be a reasonable thing to consider for an otherwise healthy dog that needs to have that has an injury to its cruciate ligament?
I think that's a great question. I would probably say no. And the reason is because you're going to have instability, especially in a young dog, throughout life, and you're going to develop arthritis in that leg. The orthotic would be a situation where you don't have any other recourse, but ideally surgery is going to be the way to get a more normal return to function, along with the physical therapy.
Right.
What about using an orthotic post-op?
Post-operatively, an orthotic would only help as far as allowing the patient to be mobile on the leg without the instability issues. Certainly.
Okay. The would potentially a patient be able to wear the orthotic lifelong? So an older patient that cannot undergo surgery and
if the patient needed it, there's no contraindication of wearing it long term.
Okay.
Some animals are able to get out of the orthotics, but sometimes there's the one or two odd patients that needs to keep it on. So sure.
And I think we should point out too that the orthotic itself is not the cure.
Right.
That what helped Bella to be able to get out of the orthotic eventually, rather than having to wear that device for the rest of her life, was that she was going through some rather intense physical therapy to build those muscles back up and build the support around the knee.
Absolutely, support is the key, and she was also undergoing the therapy as well.
Okay.
The underwater treadmill and the stimulations.
Okay. Now, would Bella still be coming back for periodic?
We do have patients that come back to maintain, which kind of brings us into another area. We have wellness programs. So once we get out of our post-operative period, you come back as a maintenance to maintain the muscle mass, to maintain the flexibility, and we can do that for geriatric patients to prevent muscle atrophy, our post-operative patients to maintain their flexibility and prevent muscle atrophy.
Okay. So, what about your geriatric patient that is as we get older, or pets get older, a lot of times they just lose muscle mass? How effective can we be at rebuilding that muscle mass or maintaining the muscle mass with physical therapy?
I think it's a definite avenue of treatment. Muscle atrophy is just probably one of the #1 things we see with older dogs, especially with degenerative joint disease. So what we like to do is get them in the underwater treadmill and work against the resistance, and again use the cavaletti rails to really make them use their back end. And we see quite a few geriatric patients that actually have some good success with that.
Okay. And what type of, the other area you mentioned was weight loss. What type of program weight loss, obesity is probably one of the biggest things we see as far as routine medical issues with patients, whether they have an orthopedic problem now or in the future.
Right.
So what types of things do you do for that type of rehabilitation for the obese patient to get them down to a weight that their body can manage and have the strength to carry that weight around?
Right. Well, again, the big thing with obese patients is get them moving. Obviously, with consulting with the referring veterinarian, we're going to get them on a diet plan. We're going to make sure they don't have a thyroid problem, and then we're going to get them moving. And the big thing is working against resistance. Strength movements and cardiovascular work, which is the underwater treadmill, is the primary.
Have you ever had a dog go on the treadmill and not do anything?
We've got
not walk?
Well, we've got one now that he likes to float.
Oh.
Yeah. Yeah, and again, you can't make these guys do things they don't want to do, but there's other courses, and you'll every now and then get a lazy patient, but I would say 99% of these guys do pretty well, but you do have the passive aggressive ones that just don't want to do anything, they just flop around.
Cool.
Yeah.
How about cats? Do you see many cats?
We do see a few cats, not as many. The dogs are the primary. We've even seen a rabbit. Believe it or not, we had a rabbit that we had fitted for a cart, believe it or not. And but we do see cats.
Yep.
And I think one of our videos that we had that we maybe didn't show was a video of the cat on the treadmill. So we certainly see all types.
Not the underwater treadmill, I take it.
No, not the underwater
Have
treadmill.
you got a
Just-
cat
yeah.
in the tank yet?
No, I don't want to be there that day.
What types of, we've talked about post-surgery and rehabilitation of the geriatric patient, the obese patient. What about a patient that is getting prepared for surgery, say a cruciate ligament injury? Is it beneficial to bring the patient in before surgery and build up the muscle mass prior to actually having the surgery done?
Absolutely, because the pre-surgical therapy, like you said, will build up the muscle mass. Lack of use of the limb in the immediate post-operative period is what contributes to the muscle atrophy. So if you've already trained the muscle ahead of time, then there's less atrophy and they return to function faster. Okay, and it's also, for some reason, they're also less painful.
Okay.
So.
And if they come in and get trained to walk on the treadmill and do those types of activities before surgery,
then they're preconditioned for that later.
Preconditioned for doing that later on. Makes it a lot easier then too. Well, very good. So, we've been talking with Dr. Jonathan Friend from the Animal Rehabilitation and Wellness Institute here in Raleigh, and we've been talking about animal rehabilitation, and we certainly appreciate you being with us here, John. Is there anything else before, in this last minute or so, that you'd like to share with people about rehabilitation? Anything that we haven't touched on that?
Well, I think we pretty much covered it all, but feel free to stop by and tour the facility. We have a wonderful facility, and we'd love to have visitors. And this is a new field of development, and it's just one of those things that's exciting. Anything new is exciting, so it can only get better.
And it is growing.
It is growing, for sure.
It is a growing field,
Okay.
which is good.
Okay. Well, we'll just give you a plug again.
Certainly.
Jonathan Friend from the Animal Rehabilitation and Wellness Institute, located at 700 Blue Ridge Road, Suite 107, right here in Raleigh. And you can get in touch with them by calling 851-5868, and their website is www.arwirwe.com. Okay. So again, John, thank you for being with us.
Thank you very much.
Certainly,
Appreciate
I've
it.
learned a lot, and thanks for sharing with our audience out there.
Absolutely. Thank you for having me.
It's been great.
Thank you.
Very good.